we have created, so her jawline is here. So I'm about a centimeter above the jawline. And then an exit point. So I've marked her marionette line, this bump here. Can you lower your chin just a little bit for me? Just your whole head. Lower it just a little bit. So this bump here, the marionette line, is what we're lifting. So I'm going to make sure I come out. This was an X. It smeared a little bit. But the X is, we want to come out just distal to this bump. And we want the last of the little cones to engage in the mound itself. And so I want one or two, if I can, of the little cones when I'm painting these back up to be in the mound so I can lift this mound up. And this is our point of entry, an exit here right by the tragus. Don't want to be right on the tragus, but very near it. There's plenty of soft tissue covering. And she's numbed up, so she won't feel this at all. But we're going to do a little puncture, literally just with a needle, and then we'll pass the needles, and I'll be anchoring on the upside with the cone's tip going in this direction with the needle, and then the cone opening won't go back down because it's open, and there'll be 3 or 4 cones on the anchor side, and then looks like we can get 4 cones for sure on the lifting side where I'll be painting the soft tissue mound up over the cones, and you'll see that in just a second. And if we don't do doubles, we've just found there's not as much strength. So if we take one finger, the difference is there. If we take 2 fingers where we can, and it's gentle lifting with 2 fingers that really gives you a sense of what you can actually accomplish with this. It's not a facelift. It's not going to be pulling way up where there's 3 centimeters of extra skin up here. It's gentle lifting with 2 fingers. I try to do it in the same plane, but it's not of great value to have wide separation. Like doing it way up here is not going to help her as much as doing these 2 that are sort of side by side and parallel, in my experience. You can do, if you're going to do the mid face, it's a different vector of pull and lifting, and you can do 2 over the cheek mound and come out, but I'll often do the percutaneous mid face lift if we're going to do that, which is, the little puncture incision and a little anchor here, and then coming out in the hairline. For her, it's really the gentle that bothers her. So we'll be addressing that. Upper or lower doesn't really matter. I think the concept is that we're really lifting as best we can, and I'm gonna just start on the upper, so she won't feel this at all. And I'm gonna make a little bit of a port of entry. I don't want to be dipping this too much into the skin, and I want to find such a small point of entry. I just want to make sure I get it both times, and then I'm going to go both ways, just to make sure there's enough room for that not to be buried. Is really the main thing. So the idea is gentle tension to stretch it, so that there's no tension on that. Okay, and you can see that even when you do that, there's still a little bit of kinking or irregularity. But if you zoom real tightly on this, Sean, I'm going to give you the background here to see.
Yeah, just
to see these. No, hang on for just a second. I need to kind of wrap it a little bit. But I want you to just be able to see these little. If you see this knot, so
yes,
I'm going to point these out. If you're in super zoom now, this little cone can only move between these 2. There's a knot here and there's a knot here on the suture. Can you see those on camera?
Yes.
And so this, once the cone will actually slip over this knot once it gets into the tissue, and it'll actually be embedded in that cone, but it goes this way, it can't go any further. And the fact that these have limitations in how much they can move, about a centimeter, is very important, because when we're doing the lifting and painting, those will both come into effect, okay? So what we do with this is, and usually we'll have a hemostat out, so you're going to press down here. But
do you mind?
No, you have one, or excuse me.
No, those are just
needle driver's fine. I mean, same principle. And you can just grab this as I come. So I'm going to go in my old port, and I'll show you what, because I can see you don't know what I'm talking about.
Yeah, just kind of stabilizing.
You don't need to stabilize it. I'm locking this, and then what I'm going to do is what I'm doing is kind of up and down a little bit through the smas.
Okay.
So, and then end the sub-Q. And then when I come out, I'm going to figure out a place, and then I'm going to push down the tragus with this little, with whatever device I'm using, you know, whether it's a hemostat. In this case, it's a needle driver. And then I also can grab the end of the needle and direct it away from the patient. And I'm pulling this through, and then as you see these going through, you can see the pointed end of each of these coming through the skin. And there's a little resistance as we do this, so I'm going to put some counter traction on it. And then once we get to the midpoint, which you can see with a knot at the midpoint, the rest of these are all pointed down. Do you see that? And I'm going to go in a straight line to my exit point right there. So I'm not going to completely finish engaging that right now, but I'm going to have you hold this up and out of the way. So bring your hand up over her head. You need to step around, see that? And then I need enough slack so that I can find that same port. So I don't want it really tight, but I want it so that I'm not crisscrossing these two. See what I'm saying?
Yeah.
You say crisscrossing? I need a little more slack again, rather lower. So you still want to keep it out to the side, but just a little bit. Right on the X-marks the spot, right?
Okay.
And then you don't need a caster VAO, but I like to have something to grab it with. Usually I use a hemostat, so the VAO is nice too. And then now both ends are through, and I'm going to turn it back toward me a little bit. And take the light out of the field because it's easier to see this around. And then lower your chin just a little bit so I can see your mouth. So at this point, I want to first make sure I'm anchored, right? So I'm going to paint these out. I don't really want to see any of the knots, right, as I pull this up. But I will feel a little bit of like the cog, hitting a cog in a wheel as I massage the points of those little cones upward. And you can see how it starts to bunch a little bit here. See this little roll of the skin? Yeah, so that's the anchor point. And it'll be more demarcated later. And then I'm going to use this other end to kind of milk the jowl up, or even paint, as I like to say, the jowl bump up over my little cones. And I know my line, and I also can see where this extra tissue is going?
Right.
See, it's punched here in the middle. So I'm going to keep milking until I've got those nicely engaged here. And I don't really want to see any of the knots or the cones here. But you can see that I've lifted this a good centimeter probably
It's already a big difference.
between this side and this side. And so I'm going to do just a little bit more, make sure they're all fully engaged in that wherever layer they're at. And then to flatten this, I'm going to do this once more, the anchor side.
Okay.
So that helps to flatten the whole assembly out. Now, once I get up to here, at some point, I'm going to start to see a little bit of potentially a little, one of the knots that come to the surface in this short of a distance. And if you lose the knot, you kind of lose the cone, right? But because it will slide off. But I don't think taking them out is worth it, so I don't do that. But you can see between the two massages, I've got only a tiny amount now of the slight depression there of the entry. It's pretty flat now. And then anything that's not perfectly flat now will come off later. I've got the end of this now, this suture here, which anyway, suture scissors always too. So this is a tissue scissors. So it should be getting out. I don't know what Dr. Polacco got out, but the suture set is what we really need. So I've trimmed that edge. And I'm going to do the same thing up here. What I'm doing is literally pushing down on this suture so that there's nothing near the skin surface. And then literally on each end, I'm going to lift up the skin and make sure there's nothing near the skin surface with it. Okay. So that one's placed that easily, basically. Same thing for the lower. Now you can see I've lifted this, so this has changed position already. It used to be, much further down, but and it's lifted this guy up too. so I still want to be halfway between my exit point and here. So I'm going to stay parallel, and I'm still maybe a centimeter and a half above the jawline here. And so that's, I don't want to create the whole tunnel, but I do want to create a pathway for this first, and just an immediate subacute plane, and a little bit in and out of the protomasseteric fascia probably. And then I need my little device to anchor me. I'll try to get out of the light here. And then, I don't know how well you can see that overhead. You can just put up a little bit. Does a little bit of light help or no? So that I have a clear path to exit with the needle. And then once I exit, you grab it. Okay, and then I'll guide that once you've got that clear of the patient. Again, this is pretty simple. There's not a lot of tension on these guys, but as you get farther in, you do start to feel it. And then there's the first knot of cone right there, right? That's the other direction, because they're bi-directional cones, right? And then you're holding that one finger down. And now I've got a shadow of your hand there, so I'm going to come here. Anytime you use lights when you're doing filming, it's a little tricky because shadows become an issue. But I'm going to make sure I drop it first straight down, because I want to make sure it's below the skin surface. And then I just don't want to be too deep with these. I like it so okay, look at it. And then distal right by my X, right? And then this side comes out. And this is where that little loop happens. But when the loop happens, it's fine, because as long as you're not twisted on the, you didn't crisscross them. And I'm going to paint these up. These are my anchors, right? So the small sides of the cone are up, and you can see that, how flat that looks. And now this is the lifting part, right? I'm taking this end of the suture, pulling it straight along my axis that I've drawn, the lift, and then the line, basically. I don't draw a line right on top of it because I want to see what's happening to the skin. But I want the dots in a straight line. I can see the entry and exit point and the midpoint all in a nice straight line. And I'm painting those cones up over. And now you can see how much lifting we're getting here. I'm just carrying that line, right? And I'm going to make sure that there's no redundancy to this. So I'm going to slide it down, to where it's well below the skin surface. So there's no way it can be near the skin surface. And it's the same thing on this side. I'm just going to slide the skin down, and I'm going to be as low as I can below that skin surface. And sometimes if you see a knot, you don't want a knot at the skin surface either. There's a cone near it, but it doesn't matter. You rather take the cone inside you and the jewelers or the small scissors just to make sure I've lifted. And these are all sterile instruments, obviously. This is a sterile field. I make sure, I think a lot of my colleagues that are non-surgeons have tried this sort of like a little office procedure, not to put gloves on, but you really have to prep this. It's an implant, so you got to treat it like an implant, literally. And it's not a bad idea to put a little 6-0 over that. You don't have to. And so what I'm doing is lifting this away from the suture. And that's really the only purpose of this, because it's such a small puncture that you really, and then you don't need to hand me anything, you can cut it. But I'm going to make this really tight to the skin here, and then see how I'm kind of lift up the skin away from it.
Right. Oh, yeah,
that's really the only thing I really care about, is that we're getting this away from the underlying suture. And now I've got just 2 throws in there. This will come out in a day or 2, right on the knot plate. So that is intentional, but it comes out quickly.
Yeah.
I just don't want it healing initially anywhere near the dermis. Should be far away from the actual, just the edge, skin edge. And then grab the other skin edge, and we're far away from the suture. The thread should be nowhere near this. Let me have the jeweler for a second. So, you know what I'm seeing, I just want to make sure there's just little gravity of the thread. Right? Not none of the thread, I just see the needle crossing that, right? So I'm doing that for demo purposes. If you can see, if you can zoom in that really close.
Yes.
So I kind of spread that entry side apart a little bit so we can see that what you're seeing is there is the needle itself. This needle, this is the end, this is the entry with the closure. And you don't have to do a stitch. I'm just telling you that I like it because it pulls it away from the underlying suture to make sure the dermis doesn't stick down onto the suture itself. That to me, because it gives a little depression that's temporary, but if you want, just by lifting this up, see now I'm lifting this away from the suture. By lifting that up, you see there's less depression there. It's not kind of sucked down by the passage of the suture. So I'm going to put a third one here. I'm going to lock that. Put two overhands and do one over here. And, but it's still right on the nut. You don't need any. And it's a 6/0 fast, so you don't need it to stay very long. And then we're ready for the other side. I'm going to go on the other side right now.